and welcome to Salmon Creek Plastic Surgery's presentation hosted by a board-certified plastic surgeon, Dr. Richard Green. My name is Sharia and I'm one of the cosmetic care coordinators here at the facility. We want to thank you for joining us today and hope that you find this presentation to be informative and educational. I encourage you to stay until the end of the presentation for a live Q&A. Attendees will be able to submit their questions via the question tab and have them answered by one of our live team members. Now please welcome Dr. Green.
Hi, I'm Rick Green, surgeon at Salmon Creek Plastic Surgery. Thanks for joining us tonight as we learn a little bit about AviClear. Now, the first question that people often ask us is, why are you bringing AviClear into your practice? You're plastic surgeons, aren't you? And we are, but we've actually taken care of people with acne for many, many years. And in the past, what we had as a tool for this issue is a laser that targeted redness, and it was we still use it actually. It's called Laser Genesis, and it works really well for mild acne. It never was a great option for cystic acne, which really is what we're talking about tonight and what AviClear can really help us with. We're actually very excited, and our initial results have been fantastic, and it's been really wonderful to have this new tool to use. Now, a lot of people wonder, how is AviClear different from other devices that we've had previously? Well, this laser actually targets the sebaceous gland, the oil-producing gland in our skin. And people say, well, are you killing the gland? No, we actually are suppressing the sebaceous gland, the oil gland. And what we're doing is we're actually taking the oil gland back to the state it was before puberty, or the pre-pubescent state of the oil gland. The advantage of that is that the skin will not dry out. Many people might be familiar with Accutane as an option for cystic acne or severe acne. And the complaint that a lot of people have with the Accutane is that it can cause dry skin to the point of actually being uncomfortable. AviClear does not do that. So what does this device treat? Well, acne. But there's many types of acne. People have mild acne that we've all sort of dealt with at various times in our life. And that can go all the way to cystic acne. And currently, we are treating acne on the face. I think we hope to, as we gain experience, be able to treat acne on other parts of the body as well. So sometimes it's the typical teenage acne that we see. Sometimes it's really challenging cystic acne on the face, and other times it can be hormonally related acne that people in their 30s and 40s and 50s can get. So there's really a wide variety of people that we're treating. And what's always been challenging, and in fact one of the things that has troubled me the most during my career as a plastic surgeon, is when people come to me with acne scarring. And what can we do about acne scarring? Now, this laser doesn't treat acne scarring, but it prevents acne scarring. And really that is the treatment for acne scarring on the face and on the back and other parts of the body. Once you have a scar, you'll always have a scar. And there's things we can do to manipulate scars or improve scars that are deep. We can remove them and cut them out, that is, and make them shallower. But we really can't erase the scar. So once you have a scar, it'll always be there. So what do we want to do? We want to prevent that scar from forming, and that's what we're actually really excited about with the AviClear, that we can prevent this kind of very uncomfortable scarring for folks before it ever even starts to develop. And that's new. There really is no other device on the market that can do that for us and for our patients. So actually, what happens with the treatment here? Well, you'll come in, you can see the laser device is right here. There's the laser treatment head, and this portion of the of the treatment head goes against the skin, it's actually very cold, believe it or not. The laser is cooled down to about 2 degrees Celsius, which is about 37 degrees Fahrenheit. So really cold against the skin. The treatment doesn't take that long. It's typically less than about a half an hour. And people can have some flaring of their acne actually after the treatment. For even several weeks after the treatment, the acne can get temporarily worse. You have to understand that this is a possibility. And to get the maximum improvement can take 6 to 9 months actually, because we're trying to suppress the sebaceous gland. And once that sebaceous gland is suppressed, the bacterial colonization, the bacterial contamination within those glands goes down, and the acne will start to significantly improve visually. Now the treatments are once a month for 3 months, so 3 treatments in total. There have been doctors that are trying extra treatments, but most people are finding, and the company is recommending, that we just stick with 3 treatments. Now, how long does the improvement last? Well, that's unknown because it's a brand new device, but we know that during the studies for the approval of this device here, there were no recurrences within 2 years. So we're getting at least 2 years out of it. I think we know from our experience with Accutane that recurrences may be possible down the road. So that is unpredictable, but we could easily do the AviClear treatment again if needed. But thus far, we seem to be good for at least 2 years. Now, the one thing that people might find disappointing is to learn that insurance at the present time does not cover this treatment. Insurance does cover Accutane, but depending on people's insurance plan, you can spend a lot of money on medical treatment for acne. Now, the AviClear treatment costs $1,000 per session, or $3,000 total, which does seem expensive. But if you look at the amount of time that people spend with medical treatment, and the cost of deductibles, and the cost of taking time off of work to go see the doctor and so forth, this actually turns out to be quite affordable. And again, topical medications, other things that have been working well for the patient are still used, so that doesn't change. And what we at SaSalmon Creek Plastic Surgery have done is that included in that $1,000, if anybody does have a flare or their acne seems to be a little worse for a week or 2 after the treatment, we have been offering Laser Genesis. Laser Genesis is the vascular laser that we've been using for years to treat mild acne. And what that really does is helps take the redness down. So even if the flare seems to be happening, we can improve that using one of our other tools, the Laser Genesis. And people have found that has been really helpful.
Hi, my name is Peyton. I'm 17 years old. I've been struggling with acne for a little bit now. I have tried multiple types of acne medication, whether that be like topicals or just actual pills. We've tried using clindamycin, retinoid, nothing's been really working. And so recently I've tried using AviClear. I've had 3 treatments now, and it's been such a great experience. Not only is the staff great, but I've definitely seen a lot of improvement in my acne and way less just flare-ups, especially as a teenager.
Hi, my name's Annalise Shannenberger. I'm 17 years old, and today I was brought in to do my first laser treatment, and I'm hoping by the 3rd one I get my results that I need. I've been struggling with acne since middle school. I've done antibiotic. I've tried everything. I've done all the names in the book, and today I did my first laser. The pain was a 3 out of 10 for me. I felt like it was very tolerable, and I would recommend.
So I'm going to hydrate the forehead.
Annalise's first AviClear treatment. She did wonderfully. We always let people know there is a slight bit of discomfort with it. It's not super painful. You don't need pain medication. But on a scale of 1 to 10, most people say it's about a 5. You get a little bit of a zing from the laser, especially if you have a deeper acne lesion. It does make it a little bit more uncomfortable. But the discomfort is just for a second or two, and then it doesn't hurt afterwards. You will be slightly pinker when you leave our office, but for the most part, it's a very, very comfortable procedure. We do like to let people know that you can have what we call an acne flare-up. Could be 1, 2, or 3 weeks after your treatment. And there is a laser called Laser Genesis, which is a nice warming laser, and it does help to calm down the inflammation in the skin, which will help calm down the acne flare-up. So you just need to give us a call or schedule that if you're concerned about it. But it is a great procedure. We expect Annalise to come back in about 4 weeks. The treatments are spaced 4 weeks apart, and you do need 3 treatments.
Hi, it's Akiko. I'm one of the master estheticians here at Salmon Creek Plastic Surgery. We want to thank everyone for attending today. Giveaway winners will be notified by phone or email. Please take your text after this event, and if you want to schedule your consultation, then reply back yes, so we can schedule your appointment. And now it's time for Q&A. Dr. Green and we are here to answer your questions. Please type your questions in the question box.